I'm Carol Cressman, and this is my blue chair story. I started as a nursing assistant in pediatrics, and that was in 1980, and then I graduated as a nurse, and then I very quickly went into the PICU, and in the PICU I just loved caring for very sick children, and then I also had a passion to teach. And so I started teaching pediatric advanced life support. So I was really proud of being able to do all those technical skills. One night I had a patient, and I started my shift, and my supervisor that night said, I'm sorry that I have to give you this assignment. I was a flight nurse, so that means I may leave, but I think that this is an assignment that you would do a really good job at. It was a 14-year-old girl that had cancer, and it had relapsed, and they had no further treatment. And she presented with us, and she had a pericardial effusion, which means she had lots of heart fluid around her heart. And she also had fluid around the lungs, so the lungs weren't working very well. The heart wasn't pumping the blood that she needed. So she needed some interventions. They didn't know for sure if she would be able to live through these interventions. The options are to do nothing and she would die, or the options are to have the procedure done and she may die. The parents decided that, okay, we're going to let her help us make this decision instead of us just making it for her. So the parents went in, and she asked that everybody stay out for a little bit. 4 hours had gone by and she looked very uncomfortable. So I entered, and I just said I wanted to at least reposition you a little bit. And it was kind of a quiet room, and there were two of her family members were in there. And I wrapped my arms around her and kind of scooped her up. She was 14, but she was having a difficult time breathing, and didn't have much energy to move. And as I wrapped my arms around her and kind of had her cradled in my arms to lift her up, I heard this weak voice say, "What does it feel like to die?" And it caught me off guard. It was very soft. I don't think anybody else in the room heard the comment. And I told her I didn't know, because my heart has never stopped and I haven't died. I said, but I have seen kids and I've been with kids that have died. And it seems they have been fairly comfortable at that time. So I just took her cues and thought this must be something, and she must have some very good, she must have some questions, and she's curious. And so then the next time I went in, her feet were so cold because her heart was not pumping the blood that it needed to be. I gave her a foot massage, and you could just see her head was just relaxed into a pillow. She just immediately relaxed, and I thought, oh gosh, here's something that I can do to keep her so comfortable. The family later said that she was ready to go to bed. She wasn't ready to make a decision yet, so I notified the doctor to say that she hasn't made a decision, so we're not going to do anything overnight. And as the night progressed, any time that I walked into her room and just was assessing her, and the family was not around, she asked me questions such as, if I'm in pain, what will you do? And I told her that I had given her a dose of morphine. And I said, I would give you some pain medicines that the doctors have wanted, and that may make you sleepy and more comfortable. And her next question was, if I'm sleepy and I can't talk to you, how are you going to know that I need more medicine? I thought, wow. in my own heart, I thought that's a really good question from a 14-year-old. And I told her, I said, I'll watch how you breathe. I'll watch how you relax, and I'll look at your face. Is your face comfortable? I will also ask your parents if they think you're comfortable. I will look at how easy your breathing is. She took some time through the night, and I believe it was 3 a.m. She said to me, I think I need to talk to my parents. And they were sleeping, so I woke. I said, who do you want? And she said, I want my dad. And I sat on the floor, and the father sat beside her and held her hand. She was pretty tired, and she wasn't very strong, so she didn't have a loud voice or anything. So I started the conversation by saying, we've had some discussion while you've been in and out, and these are some of the questions that your daughter has asked. And so we kind of went through that, and in the dark, we had no lights on, we just had our voices and just were there talking about it. It was so evident as I sat on the floor and listened to this young girl talk to her father and have a most intimate conversation. Just being really, truly present with others is such a beautiful gift that we can give. When I left in the morning, she had made the decision that she didn't want the procedure, that she was ready to die. I came back at 3 p.m. to see her, and it was so beautiful. They had gotten her up in a wheelchair, and she was out on a deck at Sanford, just out in the sunshine, and they were stamping some cards, and she was helping to participate in that. She was very weak, but she was surrounded by family. And then the next night shift, early in the morning, she died, and she died very peacefully. But that's where I think about, it's all the techie stuff that I know. I was really proud of how techie I knew everything there was about critical care. But this night, all I needed was really 3 things: my ears to listen, my heart to really listen to what she was saying, and my hands to just hold her and to give her a massage. Where do you get that kind of experience, that you are really in that intimate space? And it really truly is the essence of nursing. And to be right there with those patients. And so I really feel blessed.